India is the most populous country in the world with over 1.4 billion people. Over the last decades, India has seen a considerable growth. From being a food insecure nation, we've become a food surplus nation with increased production and even exporting of staple foods such as rice, fruits and vegetables and pulses. However, an average Indian's diet is still not diverse enough. And by that I mean there is a gap between what's being produced and what's being consumed. On the other hand, we're also seeing an increase in the coverage of safety net programs and social protection programs towards vulnerable populations. This has resulted in a decline in the levels of malnutrition over the past decades. However, the rates of malnutrition are not falling fast enough. Again, India is also grappling with multiple micronutrient deficiencies. For instance, anemia levels among children below 5 are at 67% and among women of reproductive age is at 57%. India is also largely an agrarian nation with over 80% of our farmers being smallholder farmers. With climate change related challenges, we continue to grapple with the potential risk of food and nutrition insecurity as the changes in climate wreak havoc in different ways in different parts of the country. India is also a young nation. We have a significant population that is in the most economically productive age group. And we see that as a demographic dividend. However, if we don't invest in nutrition, we might not be able to reap the benefits of this demographic dividend. And these are some of the challenges that India is grappling with. GAIN in India works closely with the government, development partners, research and academia, and the private sector in advancing nutrition outcomes through improvement in consumption of nutritious and safe foods for all people, with specific focus on those who are most vulnerable to malnutrition. Our approach is to implement evidence-informed interventions at scale. Some of our work includes supporting the government in scaling up fortification of staple foods such as edible oil, milk, and wheat flour, with our presence across 17 states, reaching almost 1 billion people. We also work closely with state governments for social protection programs such as the State Rural Livelihood Mission in Bihar in supporting women-run self-help groups in the production of supplementary nutrition for pregnant and new mothers and children below 3 years of age, with a specific focus on nutrition resilience and livelihood. We engage with the private sector in the promotion of workforce nutrition, both for their immediate workforce and the supply chain workforce. With proven models of improving access to nutrition and in create demand generation for healthy foods, we are now replicating this model globally and in other parts of India. Taking forward the Initiative for Climate and Nutrition Action, ICAN, which was launched at COP27 in Egypt, we took a subnational mapping of opportunities for integrating climate and nutrition through a climate-resilient agriculture frameworks, and are excited about the potential this holds in addressing some of the challenges and opportunities in improving climate and nutrition resilience. Finally, data is an integral part of the larger work that we do, and we are looking to pilot the food systems dashboard at a subnational level to enable evidence-backed policy action for food systems strengthening. Since 2006, GAIN has remained a trusted partner in the nation's effort to improve nutrition outcomes. We aim to hold true to that trust and continue to showcase our ability to deliver impactful interventions and innovations to transform food systems so that it delivers to the ones that need it the most. We also have the legacy of working with partners across the board to achieve larger impact, be it academia, be it the small and medium-sized enterprises, and the private sector. In terms of programmatic impact in the near future, we aim to engage with big businesses for greater commitment towards nutrition of their workforce. We're also keen to scale up interventions that look at nutrition resilience, such as the interface across climate, agriculture, nutrition, human-centered social protection programs, and in ensuring access to quality assured fortified foods at a population level. These efforts, we believe, would also align to India's vision of being a Viksit Bharat, a developed nation, by 2047 as we celebrate our 100th year of independence. This vision of Viksit Bharat has sustainability and inclusivity at the heart of all its initiatives, which aligns well with the vision of GAIN as well.